I'm Courtney. I'm going to be your nurse today.
Hello, Nurse Courtney.
Can you tell me your name and date of birth?
Justin Dalkowski, April 3rd, 1996.
Okay. I provided privacy. There's proper lighting for the patient. I'm going to perform hand hygiene. Today we're going to be doing a cranial nerve test. I'm going to be assessing your sensory and motor nerves. I'm going to ask you a couple of questions. Have you ever had a seizure?
No.
Do you have a history of migraines?
No.
And have you ever had a concussion?
No.
All right. Now I'm going to check the patient's mental status. So can you tell me what year it is?
2020.
Can you tell me who the President of the United States is?
Donald Trump.
And can you tell me where you are at?
Dearborn Heights, Michigan.
All right. So the patient is well accommodated with his surroundings. He's aware. His behavior is neutral. His appearance is dressed for the environment. And his speech is normal. He had no difficulty relaying anything to me. Now we're going to check cranial nerve 1. So what you're going to do for me is you're going to close your eyes and then plug one of your nostrils. And then you can smell that.
Peppermint.
All right. And then you can close your eyes and plug your other nostril for me. And you can smell that for me.
Okay, lemon.
All right. So cranial nerve 1 is intact, both bilaterally, and he can differentiate between different smells. For cranial nerve 2, we're going to sense your vision. So you're going to hold this about 14 inches away from you. You can have a little bit of a bend in your arm. This is 14 inches away. And then you can cover one of your eyes. You can start with this line right here.
6, 3, 9, 2, 5.
And you can go down.
4, 2, 8, 3, 6, 5.
You can go down.
3, 7, 4, 2, 5, 8.
You can go down.
9, 3, 7, 8, 2, 6.
And you can go down one more time.
4, 2, 6, 7, 3, 9.
All right, and then we're going to do the same thing with your other eye. Starting here for me.
6, 3, 9, 2, 5.
Down.
4, 2, 8, 3, 6, 5.
And down.
3, 7, 4, 2, 5, 8.
One more time.
9, 3, 7, 8, 2, 6.
And one more time.
4, 2, 6, 7, 3, 9.
Okay, and then you can do it reading with both your eyes open. Starting.
4, 2, 8, 3, 6, 5. 3, 7, 4, 2, 5, 8. 9, 3, 7, 8, 2, 6. 4, 2, 6, 7, 3, 9.
All right. So the patient's vision was 20/20 for all 3 spots. For his right, his left, and then bilaterally. They're equal. Alright, so cranial nerve 2 is intact. Now we're going to go to cranial nerve 3, 4, and 6. So what you're going to do for me is you're going to look right here, and then you're not going to follow my pen light, but I'm going to flash the light in your eyes on. Alright, and then you're gonna look here and then look that way for me, please. Alright, so his pupils were of equal size and rounded, and they accommodated to the light. When the light passed him, they constricted, and then when it passed the left, his right constricted consensually, and then the same on the other side. And his pupils dilated when away from the light. Next, you're going to follow my pen light with just your eyes. You're not going to move your head or anything else. So you can look here. Okay. So his lateral, medial, upward, and downward movements of his eyes are intact. So his oculomotive is intact. and there's no presence of nystagmus, which is like rapid fluttering of the eye. Next, we're gonna check for cranial nerve 5. So what you're gonna do for me is gonna put hands here, and you're gonna clench and unclench your jaw, and then clench and unclench your jaw, and then you're gonna move your jaw laterally like this. All right, so his cranial nerve 5 was intact. And then now you're going to close your eyes. And you're going to tell me if you feel a dull or sharp feeling.
Sharp. 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 Dull. Dull. Sharp.
All right, so for the most part, his sensory for cranial nerve 5 was intact bilaterally, except on his forehead then it was different. For cranial nerve 7, so it's your facial nerve. So can you raise your eyebrows for me? And then can you close your eyes really tightly? And then you're not gonna let me open them. All right, and then can you puff your cheeks? And then you're not gonna let me blow the air out of them. All right, and then can you smile for me? Frown. All right, so his face was symmetrical. All his movements were symmetrical, and that nerve is intact. Cranial nerve 8. Be checking your hearing. So I'm going to put this on the top of your forehead, and you're going to tell me when you can stop hearing it or feeling the vibration. And this is a Weber. I'm sorry, you're just telling me if you feel the vibration. Yep. Okay, yeah. Not when it stops. Okay, now for the Rhine test, I'm going to put it here, and you're going to tell me when you stop hearing it here, and then when you stop hearing it here as well. All right.
Gone. Gone.
All right. So the first one lasted for 15 seconds. And then in total it lasted for about 35 seconds. And now we're gonna do the whisper test. So you're gonna plug this here for me, and you're gonna repeat back what I say.
425.
All right, and then same on this side.
1092.
All right, and then you can hear me at normal volume. So his cranial nerve 8 is intact, bilaterally on both sides. Cranial nerve 9. So I would do the gag reflex here, but we're not going to do that today. And you're going to stick your tongue out and say ah for me. All right, so his uvula and soft palate moved up and down when he said ah, and the appearance inside, it was like a red pink color. There's no signs of inflammation or infection or anything like that out of the ordinary. Cranial nerve 10, if he had a hoarse voice, I would ask him if that was normal, and if not, we would proceed to find out what may be causing it. Cranial nerve 11, so I'm going to press down on your shoulders, and then you're going to push up for me. Okay, and then you're gonna lean your forehead or cheek into my hand. Okay, and this side. All right, so his strength was +2 on both sides, and then for both sides for his shoulders as well, so it's bilateral. And so his cranial nerve 11 was intact, and then for cranial nerve 12, we are going to I'm gonna say 3 words for me. You're gonna say light, tight, and dynamite.
Light, tight, dynamite.
All right. So his tongue was midline. He had no trouble pronouncing those words. So his cranial nerve at 12 is intact. Now we're going to move forward to the gross motor skills. So you can stand up for me. All right. So you can just walk normal for me. All right. His gait's normal. He has somewhat of a swing in his arms, so that's good. And then you can walk back heel toe for me. Alright, and he's able to do so. He doesn't lose his balance. Now we're going to do the Romberg's test. So you can stand straight, and then you're going to go like this, and then close your eyes for 20 seconds for me. Okay, so he didn't lose his balance or anything at all, so that's good. And he had a slight sway, which is normal. Now what you're gonna put your arms out like this for me, and you're gonna hold that for 20 seconds as well. Okay, so there's no presence of pronator drift, so that's good. Yeah, you can put it down. And then for your gross motor skills, can you do a deep knee bend for me? All right, can you hop on one foot? And can you walk on your toes for me? All right, so for the most part, he didn't lose his balance and any of that, you're good. You can come back. All right. He didn't lose his balance, any of that, and is intact for his gross motor skills. Next, we're gonna test your strength. So you're gonna hold your upper extremities up like this. I'm going to push and you're gonna resist. All right, so it was +2, and then I'm gonna pull and you're gonna resist. Alright, so +2, and then we're going to do the same with your lower extremities. I'm going to push. Alright, so now we're going to pull. Alright, so +2 on the pull. 3 on the push. And then, so his strength is intact. And now we're going to check for fine motor, so we're going to do ram, so you're going to go like this, as fast as you can for me on your knees. Alright, good. And then you're going to go like this for me with your fingers. Alright, can you do it with the other hand? Alright, now you're going to put your finger on your nose, and then you're going to come into my finger. So nose, finger, nose, finger, nose, finger, nose, finger, nose, finger. Alright, good. So his fine motor skills are intact. Now for sensory, we're going to do the same with the sharp and dull. So can you close your eyes for me? Alright. And then tell me if it's dull or sharp.
Dull. Sharp.
Alright, and then we're going to do it on your lower extremities. However, he's wearing jeans, so it might not be as recognizable.
Sharp. Give that one a little bit more. Dull.
Alright, so again, he was wearing jeans, so his appearance on his lower extremities were not as well. But on his upper extremities, they were bilateral and intact. Now we're gonna do test for vibration. So I'm gonna put this on your thumb, and you're gonna tell me if you can feel it.
Yep.
All right, and then on your big toe.
Yep.
All right. Now for kinesthesia. So You see your hand, you're going to close your eyes. And then you're going to tell me if your finger's up or down.
Down, up, up, up.
Alright, and then we're going to check on your toes as well.
Down, up,
Alright.
up, down.
Alright, good. So that is intact. Next, we're going to check for tactile discrimination. We're going to do stereogenesis. So you can put your palm out and then close your eyes for me. And put an item in it, and then you're going to identify it for me.
Penny.
Yep. And then, you can close your eyes for your other arm.
Bobby pin.
Yes. Alright, so that was intact. And then for the graphesthesia, I'm going to draw a number on your hand, and you're going to tell me what it is.
Do that one again. Is it 8?
Yeah.
3.
Alright. Good, that was intact as well. Now we're going to do point location. So your eyes are going to be closed. I'm going to touch a spot on your arm, and you're going to have to go to that with your other arm. Okay. Alright, good. He's close enough to all the locations. He was intact for that. Now we're going to check some of your deep reflex tendons. So I only have to show 2 of these. I would do each one bilateral and saying the +2. So we're going to do your patellar one. So, okay. Alright, so that's about a +1 response for that. And then we're going to do the tricep one. So you're going to be as relaxed as you can for me. Alright, and then +1 for that too. And again, I would do it bilaterally on all sides. And then another one to do would be the brachial one right here, brachioradialis, and the Achilles. Lastly and then the plantar one. So you're going to put your foot out like this and go up the lateral side and a curve. You can feel that. Alright, I'm going to do the other foot. Lateral side and curve.
Yes.
Alright. So for special considerations, I would, if it was an elderly patient, their response time and reflexes would be diminished. If it was someone who had had a stroke, one side of their body might be slower, not work the same. And then anyone with like a brain injury or trauma could also be experiencing diminished signs. And then I would document my findings